the Eye Care program. 35 years of alcohol, drug abuse, and violence prevention. Serving the East Baton Rouge Parish community since 1981.
Hello, and thank you for joining us for Eye Care Live. My name is James Upright. I'm the Healthy Minds Coordinator here at Eye Care. Today I'm joined by Ms. Becky Young and Mr. Aaron Blackledge. Thank you very much for being here with us today. Would you mind just taking a moment and introducing yourselves to our viewer?
Sure, we'd be glad to.
My name is Aaron Blackledge. I'm the Executive Director of the Crisis Intervention Center. I've been in the healthcare industry for almost 20 years now and been part of the Crisis Intervention Center for about 10, and have had an opportunity to work in the field of crisis intervention and see it evolve and really see the center grow as it has today.
And my name is Becky Young, and I worked for many years for the Eye Care program. I was a specialist, and then I was the director for a while. And when I retired, I traveled a bit, and then I went back to work at the Crisis Intervention Center because we were partners with the Crisis Intervention Center for many years before. So it was like completing a circle of all the things I had done and learned. And so today we're here to talk about the center and about preventing suicide, specifically in young people.
Awesome. Well, thank you very much again for your time and to be here with us. So, Mr. Blackledge, I'd like to start off with you. Could you tell us about the Crisis Intervention Center, what you guys do, and how it all began?
Sure. The Crisis Intervention Center started in 1970 after the death of 7 students to suicide, starting in the fall of 1969 into early 1970. Once the student body president died by suicide in early 1970, the administration and students got together and started what was known as the phone. And it was a student-run 24-hour crisis line that was run in the basement of the Student Health Center, and it served the student population. Later, in about 1974, the phone became part of what was known at that time as the Baton Rouge Crisis Intervention Center, and served the Greater Baton Rouge area. Since that time, we've expanded statewide. We still have a big focus here in Baton Rouge. Most people that went to LSU or had some connection with LSU certainly know and remember the phone. We still operate that today. We take about 24,000 calls in the Greater Baton Rouge area, which is a significant number.
Very impressive.
National statistics. And we have a lot of dedicated volunteers and staff that continue to answer the call when we see folks in crisis. A lot of folks see the work that we do primarily in the area of suicide, and while we certainly don't want to marginalize that by any means, we also want your viewers to recognize that you can call us for anything, any sort of life problem, anything that you may need in terms of emotional support. If you have, a loved one with chronic mental illness that just needs, some support through those challenges and struggles with substance abuse, we certainly get a lot of those types of callers. But with suicide, that accounts for about 11 to 12% of our callers.
That's pretty high. And so this may seem like an obvious question, but why should parents of young children and teens be concerned about the issue of suicide in their community?
Well, for parents, it should be really important to recognize that it's the second leading cause of death among those that are 15 to 24 years of age. There are 25 times the number of attempted suicides in young people than adults. So obviously we have a great opportunity to intervene in situations where children or young people are reaching out for help. In a few minutes, I'm going to let Becky kind of go into that in more detail, but I will say that one of the things that we are doing is working on securing some funding to provide what we call some proactive crisis intervention via social media. We know that a lot of teens are spending a large amount of time on social media, and instead of waiting for them to reach out to us, the national trend is that we need to proactively reach out to them.
That sounds really interesting. You just had mentioned, I believe previously, that 13% of your calls are about suicide. What other types of calls do you guys receive?
So really everything you can think of that happens in our daily lives. Number one still is generally interpersonal issues, relationship issues. We have a number of folks that call it medical concerns, financial issues, and the significance of financial issues is prior to kind of the downturn in the economy in 2009 or so, we never really had many callers dealing with financial issues. Since that time, it still has stayed in the top 10. So that's pretty significant. Certainly addiction, substance abuse. With the opiate epidemic, we're seeing more and more individuals who don't want to necessarily identify and get help, but are willing to talk to someone if their anonymity is protected. And also things with the LGBTQ community, issues related to transgender, child and family issues, and sometimes people just need resources.
Definitely. That sounds like you guys are definitely covering a broad array of people and doing a lot of help out in the community. And I know you just got into some of the families you're helping. Could you tell us a little bit more about some of the specifics of the programs and the services that you offer?
Sure, absolutely. So we have three main programs at the center. The first of our programs, which is the main thing that we focus on, is our crisis intervention services. That's the phone, as we know it, the crisis line. We also have, we do a lot of care management telephonically, and for us telephonic is defined as traditional phone, text, and internet chat. Those are the three modalities that we use to reach individuals. We see a lot of increase, obviously, on what we call online emotional support, which is text and chat. The phone was the first center to receive national accreditation for both the telephone line, the crisis line, as well as online emotional support. No other center had those accreditations at the time we received that. So that's a big focus of what we do. Our second program is what we call our traumatic loss services. Those break out into two areas. The first is what we call traumatic loss outreach. That is when we actually go to a group of individuals. It could be a school, it could be a university, it could be a business where there's been a traumatic death, and it doesn't have to just be suicide, but we go and we do what we call a postvention, which is our attempt to provide resources, provide that installation of hope, and begin the process for those individuals to begin healing from that event. Second, in traumatic loss services, we offer our survivor of suicide support group, or we use the acronym SOS. That term's a little bit confusing because people think of it as people that attempt. Mm-hmm. This is strictly for individuals that have been bereaved by suicide. And then lastly, we have education and training, which offers a wide variety of education opportunities for individuals that may need some level of training on crisis intervention, suicide prevention intervention. Those trainings can go anywhere from 2 to 3 hours to a week.
That's quite an impressive array of services that is provided by Crisis Intervention Center, especially just coming out of thinking not that long ago. It's just housed at LSU
yes.
and what you guys have now become. Mrs. Young, I have a few questions for you too. So who answers these calls, and how do they know what to say to the callers?
Oh, that's a great question. What we have, we are supported immensely by volunteers, and our staff knows how to answer the phones and how to help guide people through discovering the resources that they already have that they're not thinking of, the skills that they already have that they maybe haven't thought of, and that they and we know how to guide them through, and sometimes the ideas come from us, but often they already have the ideas and know how to solve their problems, they just haven't thought of it. Yeah. And so, but our volunteers are highly trained. We don't put them on the phone without knowing what to say, and they have a model that they actually follow to use. And we can always use volunteers. I'll talk about that in a minute.
Awesome. And so initially you were trying to, and you're still trying to prevent suicide. I'd like to talk a little bit about suicide. How many suicides are there in a given year, and how do these suicide rates compare to homicide rates?
Well, that is a very good question, and most people are very surprised to find out that the suicide numbers far exceed the homicide numbers. Now, most people would never get, when I do a presentation live, I ask them, what do you think? And most of them think that homicide is higher, and that's because homicide is covered in the media so much, and suicide's not. And there are lots of reasons for that, sometimes to protect the privacy of a family, but also there's a lot of stigma around suicide. That's also part of what keeps people from reaching out and asking for help when they begin to have thoughts of suicide. So more than 40,000 people a year die by suicide across the United States, a year. And worldwide, more than 800,000 die by suicide annually. And so the World Health Organization says that more people die annually by suicide than from both the number of murders and war combined. That's huge. That's so many lives that could be saved, you know, and that's one of our focuses. In the year 2014, and our numbers are always kind of delayed coming to us because they make sure they collect them correctly. But in the year 2014, homicides were the 17th leading cause of death, compared to suicide as the 10th leading cause of death.
And I think in Louisiana, which is important for your viewers to recognize, is as of the last reporting that Becky mentioned, we've gone from 36th to 25th in the country for the in terms of ranking for number of suicides per capita.
Okay. And going up in those rankings is the opposite direction that we want to go.
Correct.
Okay.
Correct.
Just to clarify.
Yes.
Yeah. Okay, that's unfortunate here, and then that kind of leads in and begs the question: can suicide be prevented, and if so, how can that be done?
That's another very good question. So we know that most suicides can be prevented. Maybe not all, but most certainly can. So then why aren't they? Well, when people begin thinking of suicide, they don't wake up one day and decide they don't want to live anymore. In most cases, they have a series of things that have happened to them that they had some ability to cope with and some ability to not cope. And so what they do is, without even knowing they're doing it, they give off what we call warning signs. And the warning signs might be in the form of feelings that they're having. They might be in the form of actions, things that they are doing, might be situations. It might be physical appearance and physical health, and it might also be thoughts. So how can we, a lot of that is like in their mind, how can we get in there and find out what they're experiencing? Well, you know, if they're feeling really sad all the time, or if they're experiencing clinical depression, you know, that we need to pay attention to that, and we need to make sure they know who to talk to about that. If they begin to look really different, if they begin to, maybe they were highly groomed in the past and now they've lost their ability to take care of their grooming, or maybe they quit going to school, or they quit going to work, or they quit hanging out with their groups, maybe they've quit a hobby or an activity that they used to do, and that was really important to them in the past, and now they're no longer participating in that. And it also can be like situations that they find themselves in. You know, some people might think of suicide after they lose a loved one. But not everybody would think of suicide. Everybody might hurt and be sad, but you know, so we can't list a list of situations where people would definitely be thinking of suicide. It depends on the person. What the point is if we need to pay attention, if people are changing in any of those areas that I listed. And this is on a slide that I think you may be seeing. And so the feelings, the actions, the situations, the physical and thought. So if we notice that, what do? We need to ask them. We need to say to them, what's going on? You don't want to necessarily start with, are you thinking of suicide? But you want to ask them to tell you what's causing these changes. If you're seeing a lot of hopelessness, if they've experienced a great deal of loss around people or finances or jobs or other important things, and they seem to have lost their ability to cope in a healthy way, then we want to begin a conversation and say, what's going on? Can you tell me about it? Now, eventually, if we start to listen to them and we get this flag in our mind that says, oh, I wonder if they're thinking of suicide, we need to ask that question. And we need to use that S word, because they are looking to talk about it, but they need permission from the person who's sitting there caring about them to talk about suicide. And we know that we won't, a lot of people don't want to ask it because they're afraid of planting the idea, but we don't plant a seed. If you ask that question and someone's not thinking of suicide, they're going to tell you, no, I'm not. And they're going to go on and tell you what is going on. But if they are, then they're probably going to take a deep breath, and they sort of have permission to talk about it for the first time ever. And that's important.
I'm really glad that you mentioned it, how important it is to ask outright, not to ask, like, do you have a plan to deal with this, or try to beat around the bush, but to be honest and direct.
Yeah, and the first thing is to listen to what's going on with them and listen to the things they're experiencing and the things they're feeling. And then, if you're thinking, oh my goodness, I wonder if they're thinking of suicide, then you ask the question. And let me say this, we've talked about these warning signs, but I want to also point out that if you're listening to this today, perhaps in the past, I don't want you to beat yourself up for saying, oh, I didn't realize that. I should have seen that. If you don't know the warning signs, you don't know them. And that's why we're here today, to talk about them, so more people can know what to watch for.
Thank you very much. And so to talking about watching, and now let's shift gears and talking about popular media for a second. There's the book and TV series, Netflix series called 13 Reasons, and a lot of young people are watching it. There's a bit of controversy around this series. Could you tell us or talk to us about what you've been hearing in the community and your thoughts on this?
You are full of good questions. So, yeah, and that would be inappropriate. We would be remiss if we didn't talk about that today, because so many young people and adults are watching that. So as it got popular, I decided, since I work in the field, I needed to watch it. So I have watched it, and I read the book. And what the professionals tell us about this 13 Reasons Why, whether it's the TV or the book, is that the subject matter, the professionals who work in the area of suicide prevention tell us the subject matter could have been handled a little better. It could have been, because the fear always is that you're going to get this copycat stuff happening. And what we didn't hear or see much about in the book is how to do an intervention. I think they should go back and add another season to it and pretend like it was a dream. You won't remember this, but back when Dallas played, there was a whole season of Dallas that came back, and it had supposedly been somebody's dream, and they wiped it out. And then they could do those interventions with those young people and see how interventions work and, you know, save the life of people. So what do you do with your child if your child's watched it, if your child is reading it or watching it now? I always encourage parents in every area to do what their kids are doing. Read the books your children are reading. Watch the shows your children are watching, even if you're not really interested. Because what you want to have is a conversation with them. And you want to talk with them about what could those 13 friends have done differently. Who had an opportunity to intervene with that young woman who died by suicide? And now I'm not encouraging young people to watch it. But we know that young people do things that we don't give them permission to do, or maybe they don't do it at our home, they do it at a friend's house. So if your kids are seeing it, then parents, you need to see it and have serious conversations with them so they can increase their skills.
Well, thank you very much for letting us know that information about where a lot of professionals are coming from, or their thoughts on the series and the books. So, I'm sure a lot of parents will be happy to know that. So if someone is interested in becoming a volunteer for the phone, how can they get in touch with you? How can they help and be a part of this effort in the community?
On one of these screens, maybe it'll be at the end, one of these screens on here, you'll see our website, and it's cicla.org, and they can go to the website and they can find out all the information about how they can become a volunteer. We have you can link to an application online and submit it online. You don't even have to fill anything out. You just type it up and send it in, and then I'll be the one I'll be in touch with you. And we do before we start training, we do a little short interview to make sure that it is what the volunteer thinks, to make sure we're both comfortable with this relationship. And then we do training. And so we'll tell more about the training. But here's the good part. Lanyat, the training is incredible. The people who come through it are all different kinds of walks of life. We have people who are in the medical field, in the every kind of field where people interact. And sometimes it's people who are retired, who have their kids are grown, they're gone, and they want to help people. And so everyone who goes to our training, even those who already work as professionals in this area, tell us that they learn so much from our training, because we not only teach them things, but then we practice how to help someone. So we don't put anybody on a phone without a lot of practice. Yeah, and so we do ask, the good thing is it's free. We don't charge at all. Okay. But we do ask for a commitment of some volunteer hours. So really, for our volunteers, it's like a win-win-win. It's a win for the volunteers because they gain in skills. It's a win for the community, for the people who are using our services and calling in, and it's a win for our organization, so that we can continue to offer the services that we do.
And I would just say, unfortunately, with the shift in volunteerism in the last 10, 15 years nationally, it's harder for us to get the kinds of volunteer coverage we got 20, 25, 30 years ago, because there's a vast majority, especially of millennials, that want to come, want to help, but I always use the example of Habitat for Humanity. They like to come, they want to do something where at the end of the day they can see the progress that's been made. Unfortunately, as Becky said, with our work, you have to go through training to keep yourself safe, to keep our callers safe, and also to ensure that you can properly intervene. But we really appreciate those volunteers, because we know it is a real commitment on their part to do that, and volunteers are really the lifeblood of what we do.
Definitely investing into making a big change.
Mm-hmm.
That's right. Awesome. And then coming back to you, Mr. Blackledge, can you tell us more about how the Crisis Intervention Center is funded, and what are some of your goals for the future?
Sure. So one of the biggest thing that I could tell you viewers that always surprises people is we are one of the only crisis centers in the nation that does not receive any state, local, or federal funding. Which is absolutely shocking to people. A lot of folks think that we are part of city parish government, or that we are the state government. We're not. We're an independent 501c3, and our ability to be here for another 47 years is going to be directly dependent on the support that we get from the community. So I want to mention that, because that's very important, and we would encourage folks to have dialogue with their elected officials, and let's make crisis intervention a priority. The primary funding we get is through contracts. We have about a dozen crisis lines or points of entry throughout the state of Louisiana, and a number of those are with municipalities, health plans, universities, managed care organizations, and that, for us, keeps lights on for the majority of what we do. We also are very grateful to have donors, just individual private donors that believe in what we do. They've maybe received services from us, or have family members who have received services, and that is certainly something that we're very, very grateful for. We also have some wonderful foundations that have given us support and money over the years. Many of those have been in our local community, but we've had statewide foundations and even foundations outside of the state that continue to support us. Although grants, for those of you viewers who have any knowledge of them, largely are not going to ever go towards operations. Grants are very specific now to how they're funded. So those are really just for capacity building and special projects that we do. We also get some funding from the Capillary United Way, where again we're very grateful for that. Unfortunately, with limited resources in the community, that funding has declined about 70% from 3 or 4 years ago. So we've had to do more with less, as many nonprofits have. And you know, those are really the key ways that we're funded. So I would say we're probably more non-traditional in the sense that we do a lot of contracts, kind of an entrepreneurial approach. But again, long term, we've got to identify some other support from the community.
I think it speaks, though, to the importance of the work that the Crisis Intervention Center does, that so many people within the community are coming together to prop you guys up and have you guys do the work in the community. So,
yeah.
Well, thank you very much again for your time. I've really enjoyed having you here on iCare Live, and I think that'll wrap it up for this afternoon. So thank you again for joining us for iCare Live.